Dr. Patterson, thank you so much for being with us. What's the situation like in Iqaluit right now, sir?
At the moment, as you mentioned, many businesses are closed, and we're working with people to limit as much social or non-essential interaction as possible to reduce the opportunity for COVID-19 to spread amongst the population.
Let's talk, if we can. We'll zone in, if we can, on Iqaluit's cities, the jails and the shelters. I understand cases are rising there as well.
That's correct. We've had there have been a number of cases at correctional facilities and in the low barrier men's shelter and transitional housing unit. Both of those have had cases amongst staff or residents, as well as the correctional facility.
All right. This is not going to be unique. My next question, insofar as honoring the government measures are concerned, but the COVID fatigue is very real. And I understand your region is no different. Folks are understandably getting tired, right? But as the Prime Minister says, look, the summer can be very different. We can all have a better summer if we just continue to honor those restrictions in place.
Yeah, there's a few things. And after 15 months of this pandemic, lots of people are tired. Lots of people are struggling with the public health measures. And I think we also have to recognize that it takes a lot of resources to properly isolate. And not everybody has access to those resources. Not everybody has access to the finances needed to stay home for 2 weeks. And so it's also important when we talk about test, trace, and isolate, we have to add in support, both financial and material, and the mental health support for people to stay home and avoid acquiring or spreading the virus.
That's a really great point that you made. With all this talk, understandably and correctly, of having to isolate, making sure that if you do unfortunately have the virus, you don't spread it to others. There is that economic disparity, right? There are folks that can afford to stay home, shelter in isolation, but there are a lot of folks who cannot, unfortunately, do that.
Yep, that's correct. And as a territory, it's well known that there's higher rates of housing insecurity in Nunavut, and that leads to fairly commonly having 8, 10, or more people living in one house, and isolating away from the other 9 people when you live in a 3 or 4 bedroom house is extremely difficult, and that helps drive some of the transmission that we've been seeing over the last week or two.
Nunavut's Chief Public Health Officer, Dr. Michael Patterson, we wish you the best, sir, in this battle against COVID-19. Thank you for your time tonight.